we human beings are never entirely happy with our appearances. All of us have one or the other feature which we could change if we had our way. For some, it is their eyes, their hair, their skin, their teeth, their boobs, and their bums. And for some, it is the various effects of aging. And today we investigate the ins and outs of some of the procedures applied to get these results. Good morning and a very warm welcome to Bonita's House Call here on SABC 2. Mabandla kamshukana kandaba zulomnyama endlela kumhlophe sithi kunina nonke la niphumule nikhona lithi kunethezeka kunikhomba ngophakathi sithi ebukhosini. I'm Dr. Victor Ramathesele. Lena ngulukuthetsa ngakakatlung. Le tlangwana ha e sa tsotang se metsotso ya mashomararo re furaletse hora ya borobedi useng. Now medical science has advanced in a very, very big way in recent times, giving a lot of people, especially those with deep pockets, the means and ability to improve the way they appear. There's laser, Botox, fillers, radio frequency, and many other procedures that can be done today. Now, don't forget to join our discussion by SMSing us your questions, your queries, and comments on things we do for beauty on Bonita's at 33723. We have also invited in studio Dr. Rakesh Nuaj, who's a dermatologist, and Dr. Anushka Reddy. She'll tell us a little bit more about what it is that she does. Bona ha kibo mathonga tsinzi he ngwane so kibo nketse bafana ba shebile onqoshishilis kulomkhanka wokuphopotha abantu ukuthi babukeke bebahle. Thank you very much for this discussion, gentlemen, lady. We're talking about a very, very big industry of people looking beautiful. How big is this industry in South Africa?
Gosh, Victor, it's probably reaching into the multi-trillion-dollar industry in the next 5 years. The recent figures released by the American Society of Aesthetic Plastic Surgery in March this year showed this 14% increase despite the so-called recession. So there's no stopping people wanting to look good. And you don't necessarily have to have deep pockets.
Oh, that's interesting.
Very, because it's very much affordable now to people across the board.
Why would people want to change the way they appear, Dr. Nuaj?
I think with the advent of media, people want to look similar to their TV presenters,
oh, they do?
To celebrities.
Okay.
So they want to look good, and also they want to look good at work, their appearance. There are lots of people that are setting the trend for them. And that's why, because it's also accessible, so they just want to feel good. And if you have good skin, no wrinkles, this is perceived as success in society, I guess.
I think sometimes we do underestimate what some of these procedures and principles do to people's self-esteem and confidence, which is boosted immensely by some of these procedures. And we think these people are vain, when in fact, they really, really feel bad about some of the changes their bodies have undergone or some of the appearances that they are born with that they would love to change. What's your view on this?
Absolutely. I think, it's so important that when you look good, you feel good. And we've also noticed that people are working much longer. So gone are the days where people retire at 60 and 65. And so you're having these older people in the boardroom, with these tired-looking faces competing against these young bucks. So they want that refreshed, rejuvenated appearance. And why not? You come into the doctor's office, it takes you less than half an hour to have a few shots and off you go. There's no downtime, it doesn't affect your life in any way, and it's affordable. And why not enjoy what medical science has to offer?
Now, if you come across a person who's supposed to be 70 and they look 50, what is the first impression that you should have, or suspicion, as it were? I think is that they eat well, or they sleep well, or they're using something, or what is the general view that
First thing I ask them, what have they been using for their skin? Because a lot of them haven't also done procedures, because a lot of them naturally have good skin.
All right. I think it's something that we must not forget, that some people just by nature, they seem to age well and they look good for much longer than others. Yeah.
Yes, especially darker skinned people, the photoaging is much less. So 60, 70, it's difficult to differentiate the age after the age of 50, because they can look, they can be 70 and still look 40, 45. Some of them have maintained their skin. They've used nice products. They've listened to the elders, and of course, a few of them have done some surgical procedures also to look good, or cosmetic procedures.
What does aging do to your appearance?
Aging would, firstly, when we look at how we age, it's not just the skin that ages. We age from the bone upwards. So the bone ages, so you get what we call bony resorption. muscle begins to droop, fat pads in the skin begin to atrophy, they become thin, and that all affects the wrinkles and causes wrinkles on the skin. And obviously in South Africa specifically, we can't ignore the very harsh African sun that contributes significantly to photoaging and conditions like solar keratosis, where the skin actually loses its elasticity. So what we need to, when we look at the aging phase, those are all factors we need to look at before just sticking some Botox or fillers into someone's face.
Don't talk about those things just yet. Don't talk about those. Let's look at some of the cosmetic procedure that these colleagues get up to sometimes. Let's have a look.
When I'm cycling outside, I tend to frown quite a lot. So I have quite a lot of wrinkles on my forehead, and then obviously old age is setting in, so the wrinkles around my eyes is quite pronounced.
So wrinkles on your forehead.
Yeah.
Would you sit first for me?
Sure.
Sit forward, let me just see what's going on. So basically this is what's bothering you.
And even on top of the eyebrows as well.
Okay.
It's fairly pronounced.
In here.
Yeah.
Okay, these are quite deep wrinkles. Have you ever had Botox done before?
Yeah, I've had it done before, about a year ago.
A year ago. Okay, we're going to use this sport here, which lasts much longer. It's a much better product. I can try and correct this. What it will do, it will prevent you from causing these lines. But it takes around 1 to 7 days to start working.
Okay.
Okay. This also I can correct. I can cause a slight lift of the angle of your mouth.
Okay.
That I can do.
Fantastic.
I can also help decrease your frowning a little bit. And I can also do a touch up here for these lines.
Okay.
These are telltale signs of aging, or is there anything that she has done to achieve all of these wrinkles on her face?
Well, it's part of, I would guess she's probably in her mid-40s, early 50s probably.
How old is she?
She's around 53, 54.
53, 54.
Yeah, and that's a normal part of the aging process. So she's aged like a skin type of hers, would age in this climate. She has had a little bit of Botox, as she said, but I think the Botox is probably worn off, and that's why she still has those deep wrinkles, creases between her brows.
What did you offer her exactly?
Her main complaints were she didn't want these lines on her forehead and around her eyes, and which we call crow's feet. And also on one side of the mouth, there was it was drooping more than the other side. So I offered her some botulinum toxin and a little bit of fillers.
Is that Botox?
Botox, yeah. And just to correct slightly around the angle of the mouth. Not overdoing it, just a little bit to satisfy her.
So you'd have given her an injection to achieve that result?
Yes.
And as you said, it will take about a week or anything between 1 day and 7 days to achieve the result?
Yes, usually it takes 3 to 7 days to achieve the result with
so she would have a much straighter face?
Yes.
Oh,
yes.
And for how long?
It lasts around 3 to 6 months on the average person.
And then she must come back for it after
If
3
she
to
wants
6 months?
to. If she wants to repeat it, if she likes it, she can come back for it.
So what is the trend? These women will come in for this Botox, which you'll define shortly, and they have to do it, repeat it for the rest of their lives? Or?
Well, look, you get this, if I can just give you the history about Botox, you get 2 types.
What is it?
Botulinum toxin type A.
It's a poison. It's a toxin.
It's not. Far from
it's a toxin.
it.
Toxin
No,
is poison.
Not.
Come on now, Dr. Anushka.
No.
Oh, okay. What is it?
I really don't like that word toxin.
Okay.
I prefer the word protein. But nonetheless, yes, it is. It's derived from Clostridium. So
you take it from this bacteria called Clostridium.
Yes,
yeah, very, very, very heavy bacteria.
Yes, that's
it causes gangrene and all that heavy
stuff.
I know.
But it's purified in the lab, and it's the actual toxin is diluted down for medical use. So you get various types. You get in South Africa, the Medicine Control Council accredited Botox for aesthetic use is Botox, which is made by the company called Allergan. And usually the effects of that takes anything between 7 to 10 days to take effect, and then it lasts for 3 to 4 months. The other type of botulinum toxin type A is called Dysport. It's currently at the Medicine Control Council, but obviously as doctors we use it in an off-label manner to treat for aesthetic use. The effects sometimes does take a little bit shorter to actually manifest, and it does last a little bit longer. So there's various studies which show, you know, the effects and the efficacy of these two different type toxins.
What does it do exactly, this Botox?
So Botox is injected into the muscle, and essentially it's such a simple mechanism. It inhibits the release of acetylcholine at the neuromuscular junction.
So it stops the muscle from contracting?
Essentially.
It relaxes the muscle,
relaxes the, not paralyzes, relaxes.
Relaxes the
Thank
muscle.
you, there we go. Relaxes, I like that. You're getting-
Kukuthandayo ke ungathi phela abantu badidwa imali ngoba inkinga zethu asifanani singabantu namandla wethu awafani and akufani futhi ngezinto ezibalekile kuthina singabantu. Ake sibuyele ekliniki njalo ke sibone ukuthi benze bathini odokotela onqoshitshilisa labe enginabo namhlanje ekuseni.
The texture of her face. She is on treatment at the moment. So we have, I've just mentioned this, our third one today. So she still wants to get rid of these marks and the fine pimples underneath the skin. You can feel it's very rough here. Very rough texture. So look at here also.
So
all these closed comedones still needs to go. We're going to get rid of it, but we have already made an improvement here. But she's not satisfied yet. She wants to continue with the treatment. So we are going to do another TCA 7% for her. The TCA 7% will dissolve the comedones underneath the skin, will penetrate the skin and get rid of these closed comedones underneath. It's all over. And then she has marks from acne scarring that she's had for many years. We can't really work on the acne scarring at the moment because she's on Orotane, 60 milligram, which makes the skin very tender. So we'll do that after the treatment of another 5 months. And then, but in the meantime, we can help her not to form more marks and to get the texture, correct the texture somehow.
Dr. Nuash, this patient had acne scarring.
Yes.
And some blackheads, as it were.
Yes. Some of the blackheads are quite deep on her face. So even with medication, they're not coming out. So if you try to express them, they will leave holes on her face.
Is this a patient that you'd have tried on draw Accutane, among other things?
She is already on it.
Yeah, and she's not getting better.
She's not improving, but while she's on it, we use a controlled manner to do some chemical peels that are well controlled to try and release the pimples a bit quicker, easier.
My biggest problem, Dr. Anushka Reddy, with all of these procedures is that, to me, it doesn't appear like there's a clear demarcation as to who can do what, who can do what. I mean, you are an aesthetic doctor, MBCHB, and then you studied all of these procedures that are done, Botox, fillers, and whatever, about which you'll tell us a little bit more later in the show. But then you have, dermatologists who can also do certain things that you are unable to do. But before your level, there are lots of beauticians and therapists and people who do so many things and who sometimes, I'm not even saying with due respect, who sometimes create so much damage that you guys have to pick up and get the patients a better appearance. What is your view? What is the value chain exactly in this process?
Absolutely. I think the current problem we faced with in South Africa is that there's no legislation from the HPCSA regarding who is allowed to do and offer these aesthetic procedures. By virtue of Botox being a scheduled drug, that immediately ensures that it's only administered or should be administered by doctors.
Should be obtained by doctors.
Absolutely.
Because they have to produce certain registrations
Yes,
for them.
absolutely.
And then therefore should only be used by doctors.
Only by doctors.
Because it's prescribed.
Yes. So that's fine. So from that perspective, I think we have some control over who administers Botox in South Africa. I have heard, unfortunately, of a few cases of beauty therapists who have managed to get their hands on Botox vials, and how they've managed to do that, I've got no idea. And they go onto YouTube, they watch a few videos on how Botox is injected, and they do offer it, at their salons. I have a few around me, actually, where I am situated.
Here in Sandton?
Yeah. and I'm on the West Strand.
Oh, okay.
So, you know, quiet little area, people think they can get away with these things. Fillers, on the other hand, a little more complicated, more complex. They're classified as medical devices. No control over it by the Medicine Control Council at the moment.
Okay. Ngwaneso tshwene ga ipone makopo empa he nna ke a tshaba taba tsore pele ka jeno go bona ga ona ntho e o senang ya maiketsetso lefatshe la ka jeno ke moriri wa maiketsetso ke meno wa maiketsetso ke dintshi tsa maiketsetso a ke sa bua he ka dinala matswele ka setsana le dipouna nka bua ga dikelo letsatsi. Now we'll hear more about things we do for beauty hanganga re khutla papatsong ga Ramathesele. Stay with us. Mogaiso di a lotswe gompieno re repile re ketlile re tlotla ka matsapa a tsewang ke ba bantsi go tokafatsa tsela eo ba bogegang ka yona ba dirisa merero ya science ka go farologana ga go logela go golagana rona ka tlhamalalo ka mafaratlhatlha SMS simla ka mafoko bonitas about 33723. Let us now see some of the uses of laser in the science of beauty.
Try to bear with it, okay?
Mind out. Thinking of that business of yours. What you're doing now. Turn your face a little towards the doctor.
Keep your eyes closed.
Pinch my fingers here.
So I'm going close to the eye because the marks come right down. Usually we use a protection near the eyes, but in her case, I want to get a better result. Let me just do a little bit of the scar area for her, just to try and correct a little bit here. Okay. So the scar will improve from inside out.
Hey, things we do for beauty. I want to have himene bo ambi special he bo highlighted bo metamorphosa gore ba etsa mathata mafatlho mo fatlo fumana se sena le mafume ka re se rusitse, and then this is what it has to take to try and repair the situation. This is chemical ochronosis, isn't it?
Yes, this is ochronosis, meaning her skin got damaged by using skin
It
lighteners
became
over
darker. The skin lightening creams have made the skin to be damaged, and as a result, you become even darker than you were before you started using these things. Eh?
Yes, she's used it for many years, and that's what the skin got damaged. There's not much else you can do because the damage is more under the skin, the lower layer of the skin.
Yeah.
So the laser stimulates the skin, the lower layer called the dermis, to repair. And we can never make it 100% better, but usually we can get a 50 to 80% improvement if we do 2 or 3 times the same procedure.
So how often does she have to repeat this procedure, painful as it is?
We can do it in 2 to 3 months, every 2 to 3 months. We can do 2 or 3 times, and it tends to improve the skin texture by quite a lot and the pigmentation.
I see. So this is carbon dioxide laser.
This is carbon dioxide laser, which is done more commonly on white skin. I wanted to demonstrate it also that it can be done on non-white skin, but we use a much lower range on non-white skins.
What are some of the other uses of laser in the field of dermatology where people are trying to make themselves look better?
Sometimes people have scars due to cuts like she had on her forehead. We can use lasers to improve it. Lasers can also be used for tattoo removal.
Tattoo remover?
Yes.
Completely can remove a tattoo almost completely?
I would say 80 to 90% improvement, but it would never go 100%. It does improve it.
So you do have people who come back to you and say, look, I had this tattoo, I had the name of my boyfriend, now we're broken up, now I need to remove this name or something.
Yes, this is actually tattoo removal is a big thing in America. That's one of the main cosmetic procedure is to remove the tattoos after a certain time. In America, it's very common, but it's coming in South Africa.
Why do people want to remove their tattoos?
Some people, now they want to join the police force, and tattoos are not permitted, or join airlines where they have to remove the tattoos. Some of them, like you said, boyfriend, girlfriends, wives broken up, they want to get it removed.
Oh, matters of the heart.
Yes.
So what are some of the other uses?
You can use it for surgery. We use it quite a lot for cancer surgery, repairs. There are some for sinuses, repairs, pigmentation. Also for acne scars. It's excellent for acne scars. Lasers can be used also for hair removal. It's quite commonly used. Actually, this is one of the most commonly used process in South Africa is for hair removal. There are certain type
Which
of
hair? Which hair exactly?
anywhere on the body it can be used.
It can be amputated. It can be pubic hair.
Pubic hair.
If it's that painful, I guess it would be very painful down there, wouldn't it?
It is quite painful.
But because you're talking about things people do for beauty, people
Of
do succumb to this kind of pain. Just to be beautiful.
Yes. They use different type of lasers for different procedures.
I see.
Yes.
What is waxing? I've heard women complain about waxing. But
Waxing?
I've been very shy to ask exactly what it means. What is waxing?
Waxing? Like when you go to a beauty therapist and have your legs waxed.
What does that mean?
Is that
exactly?
what? But it's not a medical procedure, that's for sure. It's more a beauty procedure.
What are you removing? You're removing hair?
You're just removing hair. So it's a manual way to remove hair. So you can laser is obviously a more longer term solution for hair removal.
Because once you've removed it with laser, it won't grow again. Where with waxing, it might just come back.
No, it will. It does grow back, but it grows back much slower. It takes a longer time for the hair to grow back. Whereas waxing, the hair does grow back much quicker. But that's definitely more a beauty procedure.
What are fillers?
So that's a very interesting, part of an aesthetic practice because you can do so much with it. Fillers is very much a combination of art and science, whereas Botox is more science when you look at a face. So with fillers, it's usually made of hyaluronic acid. Hyaluronic acid is a natural component in your skin. And as you age, you lose the hyaluronic acid. And what I'm simply doing is...
So it is the hyaluronic acid that keeps the skin nice,
supple,
tight, and moist and
hydrated,
supple.
exactly.
So as you age, you tend to lose it.
You lose it. That's what causes wrinkles and lines on the face. And all we are doing is we are simply replacing what you've lost. So we can augment lips, give you these lovely, full, luscious lips. We can give you lovely Naomi Campbell cheekbones. We can create, correct lumps and bumps on the nose.
By using fillers?
Absolutely.
In what form? How is it applied exactly?
So it's an injectable. Most of the fillers these days contain a little bit of lidocaine, which is a local anesthetic. So it's a fairly, painless procedure. I wouldn't say that people would find it unbearable. And it's done depending on how many fillers you use. You could use between 1 to 8 fillers in a person's face. And you can create, change the way the person looks, for the better, obviously.
How often do you have to do it?
So fillers usually, it depends which filler you use, but the ones that I use at my practice are FDA approved to last for 12 months. So it's probably an annual procedure, provided you're not a smoker, you follow a healthy, balanced lifestyle. Athletes, bodybuilders because of their high metabolic rates, tend to break down these products much faster.
So athletes, in other words.
Yes.
Now, you said it is the loss and the continuous and exponential loss of hyaluronic acid that happens within your skin that causes the skin to sag and whatever. Are there some of the nutritional products that one could eat by way of vitamins and supplements just to ensure that you don't get to that stage, so to replace whatever it is that the body loses?
There are these collagen products that have now flooded the market. So there is a Swedish product called Pro Collagen that has the highest collagen concentration that is accessible, to people. And but we need more studies on that, I feel. I feel those studies are wishy-washy. And as doctors, we scientists, we have to go by on studies. We need to know that there's credible data before we can offer that to our patient. But unfortunately, it's like the vitamin industry. We know that it's a multi-billion rand industry. People take vitamins, they don't really need it, but they take it. And the same story with collagen. So collagen is something you can take for now that is meant to sort of increase the collagen and improve the quality of your skin. But that's about it. So there's no edible hyaluronic acid as such.
At this point. Hey, what has been the collaboration, if any, between the dermatologists and aesthetic doctors that Dr. Anushka Reddy is? Because sometimes when I read in the press, I do find some conflicting ideas, and I get a sense that there could be some frictions between the two professions.
We dermatologists treat skin diseases, hair, nails, that's our basic job.
Skin and its appendages, yeah.
Skin and its appendages. So we try to make people look and feel good by treating their skin disease because that's visible to the outside. However, some of us do some cosmetic procedures as well, simple ones, Botox, fillers, lasers, and that's how we overlap with cosmetic doctors as well. Cosmetic doctors sometimes do a little bit more apart from skin. Sometimes they do weight loss programs. They do other ways to correct beauty. They concentrate only on beauty, but we concentrate on diseases more. Most of us.
Beautiful. Now I understand. When you do that fast. I get a holiday. We'll return and continue our discussion on things we do for beauty after the break. Welcome back. You're watching Bonita's House Call here on SABC2. And today we focus on things we do for beauty, such as this one.
So, what we've done right now, Hinty, is a system using the Venus system. It's a Canadian-based company, very innovative technology using radio frequency. And as we know, radio frequency has been around for a long time. And in someone like you know, with a little bit of loose skin, radio frequency will actually help to tighten the skin. Ideally, a younger patient would benefit tremendously more from the procedure than someone, you know, in their late 60s or early 70s. So what I'm trying to tell you is that the earlier you have the procedure done, the better the result. With you, we probably will need 6 to 7 sessions to see some sort of difference. There's absolutely no reason why you can't have more than 6 done. So let's see how this pans out for you, and then we'll reassess.
Now, this is radio frequency. Yes. So it's one of the newer methods now. It does not involve injections?
No. So radio frequency is a method to actually tighten skin. It's old technology. It has been around for a long time. The gold standard to tighten skin has been thermage. It's what we call monopolar radio frequency. It's a once-off treatment used specifically to tighten skin around the jowls, because the only other way to do it actually is to have surgery done. So now we've got a more gentler way of treating the skin. Thermage, unfortunately, is extremely painful and very costly. So this is just a more affordable, gentle way of treating the skin, and again, in the right patient.
And how is it done? Because I didn't see any injections there. So how is it applied?
So I'm sure are we going to have a demo? So we're going to be using a device specifically for skin tightening. So we're going to be looking at tightening the skin mainly around the neckline. The system we use is called the Venus Viva system, and it uses radio frequency. Radio frequency, we've been using it for years in medicine for skin tightening. So I think you're going to be very happy with the result. You're not going to see the result after the first time. So after about 6 to 7 treatments, then you'll be able to see nice contouring of your jawline. And it's not painful. It's for a few years, because as you age, your collagen is going to also break down. So obviously it's not permanent. So you will probably need to repeat this procedure after maybe 2 or 3 years, I would say.
Oh, okay.
So we know that we have the skin temperature to about 42 degrees stimulates collagen production, which is what we want. And we know that collagen is what supports the overlying skin. So this radio frequency it's not a laser device. So it's colorblind. So you won't get any post-inflammatory hyperpigmentation after this procedure. I must admit, the younger you are, the better the result. With you now, as you can see, there is quite a bit of collagen loss. So the skin is a bit sagging. So, we may even need to exceed 6 treatments. So after 6, because that's the standard number of treatments you would have, we'll reassess, and if you need more, then we'll do more. So basically, there are 2 heads attached to that machine. The head that we used for that particular system, which is a brand new system that has just landed on our shores, it's from Canada, it's a head that's actually used to glide along the skin, and it emits high radio frequency doses or energy. And with that, as we heat the skin, so radio frequency essentially heats the skin, and we want to heat the skin to between 42 to 46 degrees.
Sure,
and
that's
that
high.
stimulates collagen. And
see.
collagen is what supports the overlying skin.
Now, how much would it cost in South Africa in this day and age?
Well, if you look at this particular treatment, it would cost you about between 2,500 to 3,000 rand a
That's not
session.
bad. That's
It's
not
quite
bad.
affordable. But look, it's per session, and it depends. Now, you would need between 6 to 8 sessions on the body and 4 to 6 sessions on the face. So these are not once-off procedures, as compared to the other procedure I mentioned, thermage, which you're paying about between 25 to 30,000 rand for a once-off procedure on the face.
It doesn't look like there's an age limit to people who want to look beautiful, but people who will come to your practice with procedures or cosmetic procedures, as it were, what is the band of age that they fall in?
Actually, we get it from the age of 16 nowadays.
16?
Not common, but we do get some of them. To the age of 80, 85 years old. People say they want to feel good and look good. So if somebody comes to me and is 16 and I see there's really a problem, somebody had a dog bite and has a scar on the face and wants some fillers or acne scars, so I will give the person fillers.
I see.
Because if they need it, we will do it.
How do we treat a scar in general sense? What are the various options? If one has a scar, typically acne scars on their face, what are the various options?
Usually if it's a white skin person, the gold standard in my practice is carbon dioxide laser, because it ends up costing much cheaper and the result is excellent result. And it's
So it removes
permanent.
the scar almost completely.
I would say around 60% improvement. There's nothing that will take it
That's
there.
a good result.
Yes.
Darker skins are more challenging.
Then we do chemical peelings, which chemical peelings uses the same principle as a laser. It causes a burn on the skin, but it uses a chemical instead of a light. And they need several sessions, but it improves it 30 to 40%. There are several different other procedures that people do. Some people inject fillers, some people cut the scars, do small cuts. You can do a procedure called subcision, where you cut under the skin and release the scar tissue. And then there are several other new procedures which cosmetic doctors do. They inject the plasma in the skin, thread lifts, which they go to cosmetic doctors for it. Yeah.
So there is hope for people who've got acne scars. Can I ask you a more difficult question?
Go ahead.
I looked at your skin as you walked onto set, and I said, geez, this is a very beautiful skin in appearance. Are you using anything on your face?
Oh. That's $1 million question for me. Yes, of course. And I'm quite open about that. I think I always like to try things on myself first before I offer it to patients. The proof is in the pudding. So always try new fillers on the market, always try new places to inject Botox, different dosages of Botox.
So this beautiful
yes.
face, you owe it to good
To
genes,
science.
good genes, among other
Okay.
things, good nutrition, lots of good sleep, avoidance of
Yes.
smoking, avoidance of alcohol.
Absolutely.
But also you've used some Botox
Yes.
and
Yes.
some fillers on your
Yes,
face.
I think the emphasis with Botox and fillers is always to maintain a very natural look. You see some horror stories in the media and some pictures, you know, of celebrities, and often that's quite off-putting for the public. So, especially in my practice, I like to maintain a very natural look. And I'm very open with patients if they do want to know if I've had anything done. But I also have no issues in telling patients that, you know, if I feel that their lips are overdone, or if I feel they don't need fillers in their lips, then obviously I'm not prepared to do it. They rather, you know, go and find someone else to do it. I think it's always the doctor's prerogative to ensure that they project their sense of beauty onto their patient.
That's very, very, very good. So almost exclusively, this job can only be done by lady doctors. I mean, really, you don't want you don't want a man who's a skinny, but let's talk about glue now, and a very controversial subject. People use glue to stick hair on their scalps. And weave and all of these things, Brazilian, Peruvian, whatever the case is. Some people use glue to stick artificial eyelashes onto their eyes. And I know that Dr. Nushka Reddy has made comments even in the public media around how she's against this glue that is being used in many parts of the body. What are your views about this glue?
It's very difficult because we're not in the same shoes as these people. We must understand them as well. maybe certain things cannot be corrected other ways. Of course, using glue can be toxic to the skin because some of the glues can absorb through the skin. There are some skin glues that you can use that are safer. So for me, they must go and ask for advice at the healthcare professional if they can use the substance. And if they really, really need it, who am I to say no? Because if they don't have it, they have one eyebrow and they need another one, and they need the glue, then what can we say?
People who are doing it absolutely for beauty. You got strong views. You don't like this glue, especially on the eyelashes. Is that right?
I do feel very strongly about that, simply because we see lots of people who come in following eyelash extensions who've lost their own eyelashes. And that's because the glue is that strong that when it falls off, it actually pulls out your own eyelashes. So there's safer ways to actually, restore eyelashes.
To enhance your beauty from the eyelash point of view,
yes,
than using some of these glues.
Absolutely.
And for the hair, you don't have a problem if people are using glue on the scalp, but for the same reason, you don't like it.
Yes, for the same reason. We don't like Dr. Newart said, it's the absorption of the glue. It could be toxic.
Yeah. So they'd rather use other methods, whether they sew it in or whatever.
Yes,
but if they can refrain from using glue. We'll continue our discussion on things we do for beauty after the break. Welcome back. Ngwaneso re sa tswela pele ka hloho sa letsatsi mona go Bonita's House Call go SABC 2. Lenaneng le utlwisetsang ngaka ka tlong. Things we do for beauty. Before we talk about other skin issues, let's talk about stilettos now.
Luby.
What is the problem? Because there are people who want to suggest that if you wear high-heeled shoes, I'm not sure how long is high heel, but that you can begin to have problems with the Achilles tendon, which is a big tendon that's sitting at the back of your heel, or it could be some issues with some of the other bones and the arc of the foot. What is the major problem with people wearing high heels?
I think it causes a lot of strain on the feet, and it obviously predisposes to developing corns. And we actually inject filler. We call it a Luby lift. Louboutins, we know Christian Louboutins. Yeah. Everyone loves those red sole shoes. So those are quite high. So
they're not very comfortable, by the way.
And they're terribly uncomfortable. So
just for the amount of money that you pay, you're not getting comfort. So what is it that you're paying for here? For the red soles?
Women, shoes, bags. So what we do is that we inject fillers to actually support the sole.
You call it the Louboutin
the Luby lift. Luby lift. And we inject it into the heel to actually support the heel, so that when you do wear stilettos, it's bearable. It's a cushion. It actually provides support.
The things people do for beauty.
Yes.
But because otherwise, if you don't do that, then you develop problems at a later stage.
Yes, you do. People develop calluses, they develop orthopedic problems, which eventually needs orthopedic referral. Yeah. So thankfully, I don't see too many of those type of patients in my practice. But not too recently in the media, you may have read, there's a shift away actually by Hollywood. On the red carpet, a shift away from wearing high heels to actually wearing flats.
Pumps and stuff.
Yes, absolutely.
Because those are more comfortable.
Yes, and it's sensible.
And what is cellulite?
Cellulite is this, it's under the skin. There are these cords that are formed and cause the skin like a orange peel. It gives it an orange peel appearance. It's more genetic. That's why people get it. Okay. So there are these cords of scar tissue, scar fibers I would call them, or fibrous tissue that pulls the skin and make it an uneven look on the outside. And it's very common. It's much more common in women. It's very rare to see it in men.
But it's got a serious genetic predisposition element to it.
Yes, it has a
How do you manage it? I know he's given a dermatologist's view of management of stretch marks and cellulite. In your view, in your clinic, in your practice, how do you do
if someone presents with established stretch marks, old or new, what we have an approach in terms of over a period of time. So there's no quick fix. So what we would do is we would use what we call ablative radiofrequency. So this is radiofrequency with the device that I demonstrated with, but actually delivering the radiofrequency via needles. So the needles puncture the skin and develops and delivers very high energy deep into the dermis. And the radio frequency, like I mentioned earlier on, heats the dermis. So that stimulates, it heats the dermis up to between 42 to 46 degrees, stimulates new collagen formation. So as we know, stretch marks are caused by the tear in the collagen. So we're allowing that collagen to repair. In addition, by creating these channels with the needles, we also have access to the dermis. So following an ablative radiofrequency treatment, we then do a chemical peel, because chemical peels also tend to have a rejuvenating effect.
What results do you get with this procedure?
Sorry, what?
What results, yeah.
Well, look, it's brand new in South Africa, so we're very much in the experimental stages. But on the few cases that we've done, we've had excellent results. I would say about between a 60 to 80% improvement in stretch marks, and very, very few procedures or products will give you that type of result. In addition, I must add, we also heat the skin up with radio frequency, just plain radio frequency. So radio frequency, we know, tightens skin. So we're using needling radio frequency, normal radio frequency, combining with peels in the area of stretch marks to actually help improve
But
it.
one thing that we want to make clear is that all of these things are nice to have. Nobody must expect their medical aid to pay for these things.
Unfortunately.
It must be out of your pocket.
Yes, so
we must make that very clear.
Yeah.
Phela nakulela xesha lakudala kho umuntu bengafuni ukuba mhle wena. Yaye ke eyona nto ke esingafani ngayo yile yezindleko ezingaka besithetha ngazo namhlanje nokunyamezela izinhlungu esikubonileyo kwabantu abazimisele kanubomi kuba bona babe bahle. Akho things that you do for beauty. Ndanje ndakhumbula ke amazwi aseBhayibhelini athi inhlungu zeli xesha azilinganiswa nobuqhaqhawuli obesibulindile. Siza kuxoshelisa ke sishwangathele siqukumbele intetho yethu ke xa sibuya eBhayi eMambozana. We'll round up our discussion when we return. You're watching Politics House Call here on SABC2 and welcome back. Some mama tla he gona re bone batho ge ba o patela tšhelete ya o tsebalega le ba o khotlela botlhoko ge go kaonafatsa tsela eo ba lebegang ka yona. Ke mo ka he rona re tla sepela re tšea mafoko a o tsebalega go tswa go ba eng ba reng. Waist trainers, do they work or not?
Not.
They don't work?
No studies to show that they do. I'm a scientist.
Oh, yeah.
I need to see studies.
One issue do you have with them? That sometimes they increase pressure in the abdomen, and that can cause indigestion or
No, not necessarily. Actually, it supports your core muscles. But I think it needs to be combined with a healthy lifestyle and exercise before you see any results with them.
We spoke about the harsh elements of this country and this continent that make people's skins to be damaged and with the passage of time to age a little bit faster than maybe in colder areas. What is the role of sunscreens in ensuring that South African skins, the integrity of their skin can be maintained?
Sunscreen prevents photoaging. It decreases photoaging. We have two types of aging called chronological aging and photoaging. Photoaging occurs more on white skin, and chronological aging, everybody age like that.
I see.
So a combination of the two will make you age much quicker, and sunscreen decreases the element of photoaging.
Your views on boob job and bum job?
I love it.
You love it?
Well,
so they do work?
Absolutely. Breast augmentation, buttock augmentation in the right indications, beautiful results.
Do you do it in a practice?
I don't. That is strict. That's a surgical procedure that needs to be done by a certified plastic and reconstructive surgeon.
The best procedures that you advise, you know, the saline, the silicone, and there are many controversies around this. Which one do you recommend?
Silicone is more natural. The saline obviously is safer in case of leakage. You know, the body will tolerate it. It's so patient dependent.
What are some of the myths associated with the procedures that you do as a dermatologist that have to do with making people?
The main myth is that if they have Botox, they need to come again for it again and again, and they get addicted to it. It's not true. That's your choice. If you don't want fillers again, don't do it. And some people think that if they've had Botox, their skin gets damaged permanently. That's also not true. And most procedures that we do are reversible. Some of them are permanent, and the other myth is they are unaffordable, but that's not true.
Today we've proven that It's not. It doesn't cost you a fortune.
Yes,
you can always
do it. Yeah.
As an aesthetic doctor, qualified, well experienced in the area, sometimes using herself as a guinea pig, using some of the procedures yourself, at least Botox, at least some fillers. What is your advice to all those South Africans out there who have watched this show and would want to continue looking beautiful?
But, you know, if you can have these things done, it's not going to cost you too much of money. It's not going to cost you time, and you know it's going to make you feel good. Why not?
Don't be ashamed.
Don't be.
There's
yes.
nothing wrong in continuing to look beautiful, right into old age.
Yes, it's got nothing to do with vanity. It's all about looking good and feeling great.
And if you're looking good, you're feeling good, and then you can perform everything that you want to perform with much more confidence than you otherwise would have.
Yes.
Well said,
definitely.
Dr. Anushka. We're getting here back next year. There's lots of things that we need to talk to you about. Dr. Ndaba is not new to House Call. Thank you very much for answering our call every time we ask you to come and contribute to our attempts to make South Africans look more beautiful and, of course, healthier. Banabes, nnete ke a moroga ga ba re pikoko e gaba ka masiba go lona he barati ba tshegetsi ba latele le ba thasele e ka se tsena ba manokeng ba llano le re tanki hangwe tanki habedi tanki hararo nnete ke a morogo le tswa ke baki rona re science head tsatsi la ka je. We'll be back next Saturday with celebrity health scares. In studio I'll be hosting expert Dr Tshidi Gule as well as actress and dancer Khabonina. Beautiful talk. We'll also have Sophie, Ndaba and Lillian Dube to share some of their experiences insofar as celebrity health scares are concerned. So don't miss it on SABC2 at 8:30 in the morning. Arkopaneng hape baking it. Tanto highly amre. Thanks for joining us today. And for me, Dr. Victor Ramathesele, you take care and enjoy the festive season.